And all right, here we are. I've been looking forward to this a lot. Today, my friends here on Zoom and also on Facebook, we're going to talk about Parkinson's and nutrition. So nutrition and Parkinson's. And my guest today is a friend of mine. We met 4 years ago, over 4 years ago, on my first trip to Monterrey, Mexico, a city very close to my heart because it's the first place I went. I have some amazing friends there. My guest wrote a chapter for my book, which I had the virtual background on, so you can barely see it, but it's called Parkinson's Empowerment Training. And the cover art, by the way, because Laura is watching right now, is by Laura Almost. Thank you, Laura, so much for your beautiful art. And thank you to my guest, Cynthia Lopez Botello. Thank you for being here, Cynthia. Thank you for writing a chapter for this book. And welcome. Let's talk nutrition and Parkinson's.
Yes, thank you for inviting me. And it is a great honor for being in your book as in a chapter in nutrition. So here I am about nutrition and Parkinson, that is a very extensive topic. We have a lot of doubts. A lot of patients has had a lot of doubts. So here I am for you so that I can try to answer the most answers. Sorry, the more questions you have. So let's begin.
Fantastic. Yeah, and I'm just going to say for anyone here on Zoom and also for people on in Zoom, if you have a question, throw it in the chat box or the Q&A box. If you're on Facebook, put it in the comments. I'm monitoring both, and when the time is right, I'll ask the question. But in the meanwhile, let's turn it over. Cynthia, go for it, man. Tell us a bunch of stuff. We want to learn everything we can about nutrition and Parkinson's.
And Parkinson's, yeah. Yes, thank you. First of all, sorry if I have these issues on my English. I get a little bit nervous, and that is why I have these, speak problems. But, well, first of all, I will give you a little background for me. I am a nutritionist. I graduated from my nutritionist career in 2014. I graduated from, I did a thesis that was named Nutritional Status in Parkinson's Disease so that I can have my bachelor degree. Well, then I certified in neurological diseases. I have a master in science and public health. Then I'm finishing my doctorate in philosophy. Now I think that by December I will be a doctor.
Beautiful. That's
hopefully.
Nice.
Yes, I'm a professor at the University of Nuevo León here in Monterrey, Mexico. And I'm also an extended member of the neurology academic staff of the hospital here, also here in Mexico. And well, I started this certification. I had started it in last Friday, of medical neuroscience. It's in progress, so I'm certifying in this topic also. I want to make a little bit of emphasis here, and I wanted to present these things about me, because lately, last week, I think maybe last week, there was a patient that contacted me, and she was so worried, and I was like, I thought, I feel sad about her because she didn't know who to trust in social media, because she told me that there are a lot of professional. First of all, she asked me if I can show her my titles, because there were a lot of professional taking advantage from Parkinson's community. And I was like a little bit sad to know about this thing. And I tried to tell her that, don't worry, I am a certified nutritionist. I won't be taking advantage of Parkinson's community, but I wanted to emphasize and show you about this thing, because I think that many of the Parkinson's disease people, etc., are worried about these things, and because they have a lot of hope of finding like this cure or like this perfect lifestyle that helps them with the disease, that we also know that social media sometimes can be difficult and can show us fake things. So, well, I try to be a little bit like transparency in my work so that they can feel less worried about these things and
Well, I
must
appreciate
trust.
that. So I appreciate you saying that. I think it's really important. There are a lot of people in the fitness industry doing the same thing. But one thing I could
Yes.
say is if Dr. Ingrid Estrada Bellarmin recommends
Yes.
you, you're the real deal.
Thank
So,
you. Yes.
yeah.
She's my boss. I
We
work
know
with
that you're
her.
the real deal.
Yes, thank you a lot. And well, now the one that are hearing this conversation and don't know Dr. Ingrid Estrada, she's a neurologist from here Mexico. I told everyone like she is my mom in neurological diseases.
She's the best.
She told me everything I know about neurological diseases
Yeah.
in Parkinson disease. Well, one of the things we face on here in nutrition is that there we don't have a lot of stuff about nutrition and neurological disease. But I had the opportunity to work by the hand with Dr. Ingrid, so that she's the best.
Yeah. Man, I wish I'd love to be there and work with her. She's taught me so much too. But anyways,
Yes,
go ahead. Go ahead. This is
yes.
great.
Well, first of all, I want to talk about why is nutrition essential for the brain and what we have to know about this and the brain and how does it works. Let me, I will put this over here so it won't bother my presentation. Well, first of all, it improves our neurotransmitter function. We know that Parkinson's disease, we have a deficiency in our neurotransmitter, especially dopamine. And well, it also can affect another neurotransmitter such as serotonin, melatonin, I think it says in English. So, but first of all, it's dopamine. So nutrition, we can improve this function by a good healthy diet. It also prevents mental dysfunction. We know that Parkinson's disease is like a disease that it's neurodegenerative. It advances well in the years if we don't control or if I was thinking this morning that I wanted to tell you like a thing that was impressive for you and like every morning when you are well waking up and you have this disease Parkinson's disease and you're a challenge day with because we know that every Parkinson is different and we know that every day is different and we know that still there isn't a cure. I wanted to let you know that if you have a strong body, if you have you make your exercise, you have a healthy diet, you will make your body stronger, and that will help you fight more against this disease. So that is one of the
Great.
principal things that I think I can tell you about nutrition, and that it is very helpful for you when you are like have on the table this junk food and ask yourself why I am giving to my body if this food sorry have the nutrients that my body needs to fight the disease. And if the answer
Absolutely.
is no, well,
Yeah.
there is
Well,
the answer.
and I'm sorry, I'll interject for a minute. For
Ah,
those who don't know, I mean, it's part of a course that I have, but statistically, the number one non-motor symptom of Parkinson's is depression. And number two, right behind it, is anxiety. And, of course, I think they say 70% of caregivers also get depression. But, nutrition's so important. I always say this too. People with Parkinson's are people first. They're people too. They're not defined by Parkinson's. So I can only imagine that what you'll talk about throughout this is probably good for all of us, even though you're tailoring it to Parkinson's because of,
yes.
various factors involved, which you'll talk about. But, depression is a big thing. It's very, very common. We see it all the time in my clinic here. So it's good to know that nutrition may help to lessen depression.
Yes, and there is an interesting point in here because there are several studies that have, well, the results concluded that essentially if we have a deficiency in some acids or some like lipids, we call them, the brain won't function as well as it should. So I will talk about this later on, but it's a very interesting thing about this thing in depression. And yes, it is very often in Parkinson's disease. Very, very often, I'd say they. Well, it also prevents memory loss, may prevent problems such as depression, maintains neural tissue, and also helps us prevents dementia. This I want to emphasize in this because not everyone will have this dementia, and I'm not telling you this, but I want to emphasize because Parkinson's disease that is not treated and that it is not, well, we know that a lot of patients don't have the opportunity to treat themselves in a medical way or in a more transdisciplinary way. But when we lead that disease to advance, when we let this disease advance, it can be, well, like a consequence will be the dementia. So that is one of the very most important things we have to take care. And that is why we are, well, teaching you and everyone, seeing this chat, why it's important to not only take your medication, but also, well, take these other
eat
problems.
well.
Yes, it will. In conclusion, it will.
Yep.
Well, where there are various nutrients that enhance neurotransmitter function, and I make you here like a resume. One of the most important we know are proteins. I think synthesize these like proteins are essential, and I want to emphasize it because we know that Parkinson's disease affects muscle mass. We know that we need to eat protein, but we also know that in some person, proteins may have a conflict with medication. So if you are in this case, and I always tell you in every conversation I have with Parkinson and nutrition, if you are seeing that your medication isn't making the effect that it should, then you should go and pay attention to proteins, because maybe proteins will be interacting with the medication. It is not necessarily to happen to all the people with medication. Levodopa, it's a medication. Not everyone will have this interaction, but a lot of great amount of patients have. So if you are seeing this, you should go and ask your doctors, ask a nutritionist that knows about Parkinson's, and so that they can give you a correct diet and prevent these consequences of interventions.
Sure. Okay.
Also, well, I will not talk about I will not talk more about proteins, because I think there is a topic that we already know, that everyone knows, that you have to take proteins, have to pay attention to muscle mass. I want to make here a little parenthesis and tell you about one question you asked me about vegetarian diets.
Yeah.
I think here is the moment so that I can talk about, because I'm talking about proteins.
Mm-hmm.
There is an issue here in vegetarian diets, and this issue is that yes, they are having protein from vegetables,
Mm-hmm.
but it is not the same as protein from animals originally.
Right.
One of a very important deficiency in this kind of diets, it is vitamin B12, yes.
Right.
So if you are having a vegetarian diet, I recommend you supplement yourself with vitamin B12 because there will be another consequence of having this dietary vegan dietarian or vegetarian, because the body needs and I will talk about vitamin B12 more on another slide, but I will always recommend it to take supplements, vitamin B12, and also, well, I will recommend complex B, all the
Okay.
vitamins from complex B. Yes, vegetable protein will help our muscle mass, but it won't help it as well as animal protein.
Sure.
There is a thing that you should know about this, making this vegetable protein that we have to combine. It is very important that if we want to make a good quality vegetable protein, we have to combine a legume with a cereal. Which kind of cereal we can use? Rice, like for example, lentils with rice, beans
Okay.
with rice, quinoa. It's also a very good
Okay. Quinoa.
cereal we can combine, but we have to combine it, a
Okay.
legume with a cereal, so that we can make on our bodies a better quality protein, vegetable protein.
Okay.
And that is a very important thing. If someone here is vegetarian and are listening to this talk, always combining your plain one cereal with one legume.
Okay. I have a question.
Yes.
You mentioned that muscle mass is oftentimes affected in people with Parkinson's. And my question for you is, does the involuntary movements like tremors and dyskinesia or dystonia and that motion perhaps, does that have any or is that part of or any part of the reason why muscle mass? Because you're burning extra
Yes.
calories. If you're moving a lot, you're burning extra calories. And I just wonder about the tremor and all that.
Yes, and that is the principal reason why is muscle mass affected, because of these involuntary movements. Because I always tell the patients that it's like you are making this amount of exercise, but you are not controlling it. And
Right.
you are like using your muscle in an excessive way. And you have to like give your muscle a better diet so that we can prevent this loss of involuntary movements. Not also, for example, this that you say about energy expenditure. Yes, we have an energy expenditure, but this energy expenditure is with muscle mass. The body, the metabolism, it's like taking the energy from the muscle, and that is why it's a deficiency.
That makes sense. I've had several clients over the years come in here and say, my doctor needs me to maybe do some strength training and build muscle because I'm losing muscle mass. Sometimes they're even losing bone density too. And it could be
Yes.
other contributing factors besides Parkinson's, but you know, I see muscle mass. I'm lost for words today. I'm not sure why I can't seem to find the words in my head. I see loss of muscle mass very, very often here. Oh, and I know what I was thinking is it's almost like they're eating the same as they used to, but they're burning more calories. And it's kind of like,
Yes.
I don't know if this is right, but I would call it almost like malnutrition or
Yes, exactly. Yes, and you are very right about this. And there is this is a point that, for example, when one of that is when I will talk about any other person that doesn't have the disease, right?
Mhm.
They are trying to. There is like a guy that he is trying to gain muscle mass because he wanted to be like physically. He wants to see like some way, and he's making a lot of exercise, no? And this exercise is strength exercise, like to the muscles. But he is not eating well. He is not controlling his diet. He is eating like junk food, making 2 hours of exercise, but eating junk food.
Sure.
I will assure you that he won't be able to create a stronger muscle mass, because remember about this thing, we need to make a balance between exercise and diet, and it is very important. If you are making a lot of exercise and you are not having a good diet, you won't be able to see the results from your exercise that you are doing. So this is a
Sure.
very important thing. And another thing I will make also an emphasis now in Parkinson's disease, there is a huge deficiency in all of the patients that, when we grow older, our appetites begins to low. It is lower, our appetite. So it is when I give my patients these diets, no, the first thing they tell me, it's like, oh, it's a lot of food. I won't eat everything. I can't eat everything. And they're making these exercise, but they don't want to eat all the portions they need. The
Right.
exercise won't help them. They need to eat the portions. I know sometimes we don't have like this hunger, but the body needs these calories, needs this energy, so that the exercise can help you more, and we can help prevent this low muscle mass. So
Yeah.
it's an interesting thing here.
Well, let's work backwards from 1 second.
Yes.
So I always say to people, strength is the foundation for good balance. Okay. If you don't have
Yes.
enough strength, it's really hard to have good balance. If you don't have enough muscle mass, it's hard to have enough strength to have good balance. So if you're malnourished, you're not getting enough protein, you're losing muscle mass, you're not going to be as strong as you were, which means your balance is likely to be more compromised, which can lead to a higher risk of falls and falling and injury and then hospitalization. And then, of course, the number one, not to scare anyone, but statistically, the number one cause of mortality or death in the Parkinson's population are complications from a fall down, get a concussion, go to the hospital, maybe you get COVID, God forbid, or some kind of problem. Maybe there's some other factor in that's not even related to Parkinson's and you die. I mean, this actually happens. Statistically, the number two reason, last I checked, and Dr. Ingrid Estrada actually wrote for my book as well about breathing issues and Parkinson's disease, because of lack of dopamine in the ventilatory airways and the parameters, and how in rigidity in the chest muscles of the chest wall can be a factor and prevent expansion of the lungs to take a deep breath. But statistically, complications from breathing issues are number two cause of mortality. So bottom line is, as I keep wind my way back around to it, is strength is so important, which means we have to have enough muscle mass, which means we need to feed ourselves so we can get that muscle mass in addition to working out and do strength training. And the only way to really boost up muscle mass besides strength training is eat enough protein.
Exactly.
Right? So that was a long dissertation, but I want those who are listening to realize that the foundation for all of it is food, quality food, and how much protein you're getting and what quality of protein. We got to have the protein as our base to get the strength, to get our balance, to move better and all that.
Yes. And here I want to talk about, because it is a very common question about supplements with protein, if
Sure.
I recommend it. And I always tell them it depends about the necessity of the patient. If I had a patient that already lost every muscle mass, and that she or he has this, it's like a step with having this disease called sarcopenia, that it's when they lost every muscle mass and etc. Then or have a trouble with eating food because they can't swallow the food correctly, then I will recommend protein supplements. But if you don't have your muscle mass, it's normal. You don't have a deficiency. It's normal you don't have any problem in eating, or swallowing or anything, I will recommend the food. Also, it is not necessarily for you to take a supplement in protein. It depends on the necessity of the person. And if you can eat well, or for example, I have some patients that they can't eat all the portions because they say it's a lot of portions. I am already full. I can eat them, but we need to give them more protein. Well, I give you a supplement so that I can give her or him all the calorie intake they need. But if you don't have problem with that, you can eat all your portions. You have a normal muscle mass, but you only want to protect it. It's with proteins coming from food. It is well.
Yeah. Okay.
Yeah,
Okay.
I think it's a very common question about these kinds of supplements. Well, another nutrient that I want to talk is about tryptophan. Uh, there is a very important thing here with this nutrient because it is related with depression. We know that there is a neurotransmitter called serotonin or serotonina, and in Spanish,
Mhm.
that
Yeah.
it's the
Serotonin. Yep.
one.
Mhm.
Yeah, it's the one that controls our state of motion of emotions, control our emotions. So if we have a deficiency in this neurotransmitter, it will appear the depression. And there are ways in diet that we can help our body produce this neurotransmitter called serotonin, and it is with food that contain tryptophan. This is like an amino acid. It's like a part of the proteins, and you can see it right here. Where is the principal foods that contain them? It's eggs. Eggs also have a lot of protein.
Mhm.
Fish like I always recommend salmon or
Mhm.
tuna. There are the principal proteins that I always recommend. Legumes, whole grains, nuts. If you can see it, it is not a difficult nutrient to obtain. We can obtain it with a very common diet, with eating our eggs every morning or eating fish every day. We will have enough uh, tryptophan on our bodies that will help us produce this neurotransmitter that is called as serotonin. And
Mhm.
also, well, if you have already the depression and you are medicated, um, it will help your medication to get better on your body
Mhm.
and have pass better the depression and don't have these episodes of we know they sometimes have episodes, good days, bad days, etc. So also it is very important about the diet, and I was talking with a patient that has depression and Parkinson disease. uh, it is very interesting because he entered my program of nutritional program with diet, etc. He was very enthusiastic about this program because he told me he was had several months with inclusive with suicide mental
Oh,
problems, and
yeah.
and and I told him that he needed to protect his body. He was the principal thing, and well, he was very enthusiastic about nutrition.
Yeah.
I talked with him last week. It was his sorry another consultation, and I talked with him. He was another person differently. He 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 thought that when he ate these kinds of foods that I was recommending him. He told me like I feel my body different. I feel that my body has the strength, sorry, so
Yep.
that in my bad days, when I'm feeling bad, when I'm feeling very down, I go and see, I go in and eat my salmon and eat my all my vegetables or fruits, etc. And he sees a a huge improvement in this thing. And
That's
he was
great.
like, yes, and I was red because it was completely, it is, well, it passed 1 month since since the first, since the first time I saw him, and it was a very different person, but he was like very in in this program. He was like motivated to do it. He was
Yeah.
like, this is the thing that will help me prevent suicide. and
Oh man, yeah.
and yeah, he was like, this patient was awesome, and I saw very great advance in him. And also that he was feeling better. He was he said me that, well, he was depressed because of Parkinson's.
Yeah.
He It was a very difficult thing to him, that tell
Yeah.
them that
Imagine that.
yeah,
Yeah.
that he had Parkinson's. So uh, when he saw that it was in his hands, uh, to deal with this disease, that it's not that the disease is controlling his body, things changed to him.
Yeah.
And was very interesting thing this, and I wanted to make a little parenthesis on this case.
Hmm.
That is a very
Interesting.
important thing. Yeah, and it is interesting because we can see how the power of a good diet can help our bodies, not only physically, but also mental, and also help our brain. And that is why I'm here, no? Talking about you, about the importance to eat well, no?
Absolutely. Yep.
Yeah. Well, another nutrient that is very important is calcium, and here is one of the. This will answer also one of the things you told me about bone density, and
Ah,
taking
yeah.
yeah, the bone density. It is also very common. Uh, it is. I have seen it more in women because also of the hormone. All of the hormone problems they have,
Yeah.
and it is very common in women. But it is, and we know we have to take calcium. But an interesting thing we should know is that we have to combine calcium with vitamin D, so that we can have calcium absorbed properly. If we don't combine, if we are supplementing ourselves with calcium and we are not taking vitamin D, we have to pay attention if calcium is absorbing, because in most cases it doesn't absorb without vitamin D. So it is very important here to take in both. It's a complement, calcium and vitamin D. Also calcium, there is like a bone density, but calcium also has some functions in neurotransmitter, because the calcium helps neurotransmitter function properly. Helps, like, okay, we already synthesize dopamine, we already synthesize serotonin, but these neurotransmitter have to work. And calcium is the responsible of making these neurotransmitter work properly in our bodies, and
Sure.
go and do all the functions in our brain, so that we can walk better, improve our movements, etc.
Okay.
Yeah, I don't know if you have a question.
No, I'm absorbing all the information. I'm thinking about I do have one question. Is
Yeah,
bone density, let's say diminished bone density, more common in the Parkinson's population? Does Parkinson's add to any bone density issues? Because sometimes it's just aging, and it seems to be
yeah,
women more so because of hormones, and a lot of people with
yes,
osteoporosis, things
yes.
like that. But what role does Parkinson's play in bone density?
I think here is like, it's, well, all of the studies I've been reading, they related to age more in most of the cases.
Mhm.
And we know that, well, in the past times, Parkinson disease was more common in an older age, but nowadays, nope, that is changing.
It is
And
changing.
yeah, a lot. There is, and I am impressed in this thing that it is changing. That there are younger persons with these kind of diseases, And this about body density is more related by the age and hormones.
Yeah.
I will have in my part, I will have to investigate some if I find another article that talks about younger Parkinson's disease and bone density, so that
Yeah.
we can talk like a more specific thing here.
Well, I'll just interject for a moment. I have absolutely no data to support my thought or my hypothesis or my theory, but if you think about it, if you get to a point with Parkinson's where you're not moving as much, you're not doing as much, I can see where if you lose muscle mass, you could also lose some bone density because, for example, walking, the impact force of the foot hitting the ground. Well, I used to work for a podiatrist. We used to teach this all the time, that functional movement, walking, punching something, if you're working out and doing some boxing and hitting a bag, well, anytime you have the impact force of that vibration coming into you, that frequency coming into you actually helps with bone density, right? So
Yes, yes.
you're walking less, you're moving less, you're exercising less. So I could see where maybe that might play a slight factor. I don't know.
Yes, and it is a very important thing, and I'm sure that it will affect the bone density because they are like a sedentary persons, and we know that a sedentary doesn't only affect our muscle, also affects our circulation, our like you told our bone density. Also, I think your theory I think it will be proved. That's this theory.
Okay.
Yeah. Well, talking about depression, another vitamin that will help us produce this serotonin, this neurotransmitter, is vitamin B6. That is why I was telling you in the first thing, take or supplement yourself with complex B, because all of these vitamins produce serotonin, help us with the dopamine, help us in a lot of ways in our bodies, and this is one of the vitamins that I recommend you to supplement yourself, complex B. The other vitamins, we can have them by our daily diet.
Okay. Very good.
Well, I specifically made this slide about mental health because I had this case about this patient that I was telling you about depression. So for me, it was very important to talk about mental health. We know that mental health, it is a very important topic nowadays because I think COVID-19 also affected our mental health in some ways. And I thought it is a very important topic that we should know, and that it is also related with diet, with a good diet. And if I will always tell you, if I give my brain all this junk food, what are you giving? What nutrients are you giving to our brain so that he can make all of the work that he should? Any nutrients. So it is a very important thing. One of the principal nutrients here in our brain is the essential fatty acids that comes from fish and vegetable oils, principally olive oil and salmon and tuna. What does this fatty acid makes on our brain? Well, it helps the neurotransmitter to be captured in a better way, and like brain capture the neurotransmitter, and then he can transmit it, the signals, to all of our bodies. So that what I was telling you in the slide and before this one. Okay, we are giving all the nutrients that my body needs so that he can produce this neurotransmitter. Okay, and he produced them, but then if we don't pay attention to what our brain is doing with this neurotransmitter, if he is transmitting it to all the signals, well, we have to pay attention also with this, because Sometimes you will have the neurotransmitter, but they won't provide the signals to the rest of the body. I don't know if I explain myself like a little bit in here. For example, you have dopamine. We know that dopamine interacts directly with the movement or the movement on our body. So if our brain produces this dopamine, but has the incapacity to transmit it to all the body, it is like useful to the brain to have all this dopamine. I don't know if I explained a little bit here, but it is very important that, for example, these essential fatty acids, one of the principal things that they do to our body is that they help the brain to transmit all these neurotransmitters to all of our body. They tell, okay, dopamine, you are already here. Go and make and send a signal to our body that needs to move, that needs to make this, and that is what fatty acids do. I'm
interrupting, but that's real. That's what we need. We need, because the lack of dopamine is the primary reason for diminished quality of movement, right?
Yes.
And so would this help with things like freezing and all that? Like
yes.
Maybe somebody won't freeze up as much, or akinesia, where they try to get started and they know they want to go, but they can't step forward. So
yes.
This would help to increase
exactly.
dopamine production. Is it production of dopamine or sending the dopamine?
It's sending the dopamine because product exactly. It's sending the dopamine to act, to do their
its job, right?
To do its job. So because dopamine, for example, here, levodopa, those patients that are taking levodopa, levodopa, what is doing to our body, it's producing dopamine. It's helping us produce dopamine. That is what levodopa does. But for I was telling, okay, we produce dopamine, but what thing is helping dopamine to send his signals and do their job? Well, here enter fatty acids. Essential fatty acids, like go and say, oh, dopamine. Go and work.
I had completely forgotten this, so I'm glad you talked about it, because we need everything we can get to help people move better, to produce or send enough dopamine signal to the body so we can move better, reduce fall risk. And essential fatty acids, completely forgot about it.
Yeah, and this is a very, you don't have to take any supplement about essential fatty acids. If you every day make your salads and include olive oil, include salmon 2 to 3 days per week, you will have the essential fatty acids that your body needs. Not necessarily you have to take like these pills that have essential fatty acids. I'm not talking about omegas. You don't have to take these pills that they sell us that it's omega-3, 6, and 9. No. You can have them from diet.
Okay.
Yeah. Well, folate and vitamin B12. Here I make my emphasis in vitamin B12 that I was telling in the slide before this about vegetarian diet, that why it was important to supplement if you are a vegetarian or a vegan. You have to take this supplement of vitamin B12 because it helps to regulate mood. If you are, it's one of the principal things, but it is here I make a mistake. It is not. They are important in the metabolism, in serotonin and other terms. Yes, it is important. Here I made a mistake. I don't know why.
So for anyone watching, forget the word not. It is important. Okay. And metabolism of serotonin and other neurotransmitters. Okay.
That is what here I emphasize about brain. I'm only telling the functions in brain, but B12 also helps in muscle. I want to emphasize this. Vitamin B12, it is not the only function it has. No, it also helps muscle mass.
Okay.
Yeah.
Excellent. Okay.
Yeah, it's like, I think I have to emphasize here. Well, like it's Parkinson's disease. I have to tell about the brain function, especially. And I was, well, I wanted to tell you also that I tell you a lot of things, and Laura almost won't make, she knows about this, about antioxidants. She's one of my, she helps me to go and tell another people, hey,
Mhm.
you have to eat antioxidants, because
She's the
antioxidants,
best.
yes, she is.
She's
Antio-
amazing.
Antioxidants, it's a very important thing in Parkinson's and neurological diseases because it helps protect our neurons. And for example, in Parkinson's disease, we have like this deficiency in our neurons, and we begin to lose our neurons. And antioxidants, what helps our neurons is that they slow the damage that they are having. We don't know
Okay.
why are they damaging. That is why we don't know the cause of Parkinson's disease. What is making the neurons to be damaged? We don't know that, but we can help improve these neurons we have on our brains. And here it is an important nutrient that will help that. That is antioxidants.
Okay.
And yeah, and it is. That's why I always tell you, if you have Parkinson's disease and you are on the beginning stages, take antioxidants. Eat antioxidants so that the disease won't advance faster.
All right.
Well,
Sorry for my commotion over here. I just realized my computer's not plugged in, and I don't want it to die.
no, it's okay. It's
It
okay.
would not be good for the computer to die right now. Okay.
I will
Okay,
talk
carry
about,
on.
yeah.
Sorry.
Now I will emphasize first in vitamins and then in minerals. This is kind of a little bit of science. If you don't understand something, let me know, because maybe you will see some like scientific words, and let me know so that I can explain it in a more pacific way and
Okay.
not a scientific way. Well, vitamin C, I will focus first in vitamins and what they do to our brain and to our neurotransmitter. That it's the principal thing that we should pay attention. Vitamin C is involved on the structure of neurons. It helps the neurons have the perfect structure. And also it helps the neurons to survive and to maturate as they should maturate. So why? Because this will help. We know that the neurons are the ones who make the neurotransmitters. So if we have a damage on our neurons, we won't make dopamine, we won't make serotonin, we won't make melatonin, and a lot of neurotransmitter that exists. So
I
that
did.
is why.
Yeah.
Tell me.
Well, I'm interrupting. I'm really sorry. I actually didn't realize vitamin C played this role.
Hmm?
So we're talking serotonin,
Exactly.
melatonin, dopamine. We're talking
Yeah,
about their survival, the structure of the neurons.
exactly.
So neuron health, the process of differentiation, so the maturity
Yes,
and
the maturity
survival.
and survival.
Wow.
Exactly.
So and it also helps to modulate neurotransmitters. So I didn't realize that about vitamin C, and that's really good to know.
Yes, and one of the principal things all the people, when we talk about vitamin C, the first thing we have is, oh yes, it improves my immune system, no? It protects my immune system
Sure.
from diseases. But no, vitamin C also have an important role in the brain. And one of the most important roles is this one, that it helps the survival of the neurons, it helps the maturity of the neurons, and the structure principle. And like I will remember this and tell you another time. If our neurons aren't well and begin to damage, we won't have enough neurotransmitter. It won't produce enough neurotransmitters. So that is why we have to protect our neurons.
Okay.
Yeah. Well,
Yeah, that's really, really good to know.
yeah, and for example, vitamin C, we can have them like in all citric fruits. For example, orange, lemon, mandarin. All of these have a huge amount of vitamin C. Only one thing that I should tell you, if you are going to eat an orange or any kind of citric food, don't cut it and let them there like 10 minutes, because I'm also preparing another thing. No, it loses the vitamin C. It's like it occurs like an oxidative process that
Mhm.
vitamin C loses. So we have to eat it right away. If we cut the orange or we cut the lemon, we have to eat it right away so that we don't lose the vitamin C it contains.
All right.
Yeah, it's a tip about vitamin C. Well, let's talk about vitamin A. Also, vitamin A controls neuronal differentiation and the formation of our neural tube. That is the part of the brain that is on the back brain. It is well known that low levels of vitamin A are related to the incidence of Parkinson's disease. So this
Wow.
will help like as a prevention, and if other people are here are seeing this talk and don't have Parkinson's disease, and they are seeing like to protect themselves and have a healthier life, you have to pay attention to vitamin A, because in a lot of research they found that if in their lives people that didn't have enough vitamin A in their bodies have a greater incidence of having Parkinson's disease in future stages of their lives. So
Wow.
this is a very, very interesting thing.
So I
And
didn't know that about vitamin A either.
yeah, and that's
That's
why
really interesting.
yeah, and that's why I try to talk about you like in a more scientific way, so that not only you can say, oh yeah, I need to eat my veggies or my fruits, no, because it helps my muscle mass and it helps my constipation. No, there are another things that these vitamins and that these all the vitamins and minerals that have these veggies and these fruits, there are a lot of functions that helps us in the brain in a more
Okay.
scientific way. Yeah. Well,
Great.
here I talk about complex B. That this is one of my favorite vitamins, because it's like they have a lot of functions. They do a lot of things in our bodies. So this is why I recommend to supplement. You can also have it from the dietary diet or for your daily diet, but I recommend it to supplement yourself also with complex B, because it not only participates in our brain function, but it also participates to regulate huge enormous functions on all of our bodies.
Mhm.
I will talk principle of these vitamins that are the most essential in our brains. One is vitamin B1. What tells that it helps here with muscle contraction, that I think muscle contraction is a very common symptom in well, muscle contraction, no, like rigidity, and like
Sure.
this. Yeah, it's a very common symptom in Parkinson, and we have we have to know that vitamin B1 help transforms all the energy that comes from carbohydrates or cereals like rice, legumes, etc., fruits, etc., transform them into energy and involve them in the muscle contraction. That is the principal function of vitamin B1. It doesn't have protein, it doesn't have anything, but it helps to, okay, this is the carbohydrate, come, I will take your way to the muscle so that you can help the involved in the muscle contraction. And it is one of the, this is one of the principal things about vitamin B1. Helps to convert energy and into from the carbohydrates and involved in muscle contraction.
I know that when I take B, like a complex, I always feel like I have more energy. I also know that if I forget to take it, I can feel the difference.
Yeah, and
Right.
here
So
is why you
yeah,
you
that's
feel that.
interesting.
Yeah, it's because And it is not only the vitamin B1 that helps to produce energy in your body. There are a lot of vitamins there that about complex B that do this, but the principal function of vitamin B1 is this one. Another vitamin of the complex B is B3. This vitamin, it is considered as a neuroprotective in Parkinson's disease. That is our principal function of this vitamin. So if we consider this vitamin as neuroprotective, what does it does? Protects our neurons. Like I was saying in the slide before this one, we have to protect our neurons so that we can let them produce the neurotransmitters that our body needs for their correct function. And one of the vitamin B3 helps to protect these neurons.
Great.
Vitamin B6, it helps, well, we talk about the protection of the neurons. Let us talk about now about the production of these neurotransmitters and the development of these neurotransmitters such as dopamine, serotonin, melatonin. Well, vitamin B6 participate directly with this production and with this development of neurotransmitters. So that is very important to take. So that I was telling you, and I will always tell, take complex B, supplement yourself with complex B.
Yeah.
And B9, that is called also folic acid. It's the common name of vitamin B9. It protects about our mental and emotional health. There is a lot of research of this folic acid and with mental health disorders such as depression, because they have found that that persons that have a deficiency in folic acid will have a greater incidence, will have a greater incidence to be a depressive person or to have as a mental health problem in the future. So that is why many health information tell us that we have to supplement with this kind of folic acid or vitamin B. But if you are taking your complex B, it is here. You have the enough amount for yourself.
All right.
Yeah. Well, vitamin E, and here I put this brain because I like it, because vitamin E, it like regulates everything. It helps control and maintains all that function of our neurons. It is, and we know that vitamin E is we related to the skin to make a healthier skin, no? And to our faces and everything,
Sure.
but no, it also participates in our brain, and it modulates. It's like, well, I will maintain that all the neurons are functioning as they should, and also protects the membranes because vitamin E is considered as an antioxidant, and like I was telling, antioxidants help protect the membranes of the neurons so that they don't damage. So that is why vitamin E regulates and maintains all these functions.
Okay. I have can I ask a question real quick?
Yeah.
I know that Dr. Lisa Moratori, Stony Brook, Long Island, New York, she was telling me, actually, I read another thing. It's really interesting. But first of all, when people exercise after taking medication, it helps to the absorption, the uptake of the medication. And now I know this is off topic, but you might find this interesting. There is at least one clinic in Australia, and what they're doing is they're doing this thing. They administer chemotherapy to cancer patients, and then right after therapy, they leave the therapy room, and they go right to the gym, and they exercise. And what's happening is they're having tremendous results with the uptake of the chemotherapy. Like, it's much more effective. So what I just thought of, what I was wondering is, does exercise, specifically it would be cardio, like, I mean, I need to go back and qualify what I just said. Lisa Moratori and then the people in Australia are saying that elevated heart rate, and it doesn't have to be like super crazy high elevation. It could be just less, is equivalent of walking as fast as possible for 20-30 minutes or more. But bottom line is, cardio, elevated heart rate, helps with medication absorption Can it help with supplement absorption?
Yeah, because the here what it's doing to our bodies is it accelerate to our metabolism. And if our metabolism is it's accelerated, well, everything that we are eating, such as nutrients from food, medication, supplement, will absorb better because we are accelerating our metabolism. And there is a very interesting thing because we also see that in Parkinson disease we have a slow metabolism, and that is why and very slow because a lot of have constipation, etc., and other problems.
Oh yeah.
And this is because the metabolisms that their bodies have is lower than a normal metabolism. And there is, yes, it will help us absorb better our supplements, our dietary intake, everything in our body, because the answer is that they are accelerating our metabolism so that we can, I forgot the word, but like absorb better all these nutrients.
Yeah, that they use the word uptake, like medications
uptake
will get into your system faster and
exactly,
and they'll have a longer lasting effect if we exercise. Yeah, so that's pretty cool.
Talking about this, but I will tell you one example with one of my patients that she was telling me, and it was a very interesting thing because she began with this. I think you know her. It's Angeles. I think you know.
Oh
this
yeah,
patient.
I know her very well.
Yeah, she's awesome. Well, she began with this also with this program, and she was telling me that one of the symptoms that she saw like in rapidly way was this, that she began to notice that the medication was absorbing better. But why she noticed this? Because she began to make like a everyday exercise. She proposed herself to do every like 7 days a week make her exercise, and she saw that medication lasts longer in her body, and I was telling her precisely that it is because she is accelerating her metabolism, and that is why it is very important. And another important thing why we should be balanced with exercise and diet, because if you are doing exercise, you are accelerating your metabolism, and you are going to help that our diet will absorb better in our bodies, and we are going to uptake better the nutrients that we are taking on the foods, right?
Yeah,
and on
absolutely.
medication and everything. Yeah.
Well, I think it's fascinating. And
Yeah,
of course, that goes for any of us. I mean, again, people with Parkinson's are people first. And yes, there's symptoms. Well, their metabolism is slowing down usually, and this and that and the other thing. But there are a lot of reasons for people to have diminished metabolism. So really, it's kind of funny. Exercise is good for us, all of us.
Yes.
Not just people with Parkinson's, everybody. And for any of us, if we exercise, it's going to help all of us with uptake of medications and supplements and everything we put into our bodies. So just I'm emphasizing that because for people watching and people who watch this in the future, just realize we're talking about Parkinson's. Yes, this applies to all of us.
Yes, it is. And I want to tell you about one thing, that I always tell other people that I see that a person with a disease that has the reality of living with a disease have a better quality of life than a person that doesn't have a disease. Why is that? And this happens because they have this disease. They know that their bodies need to be healthy, and they're making all of the things they need to do to be healthy because of the disease, and they are protecting themselves. But a person that doesn't have a disease, well, it's like, nah, I don't have anything. I can eat junk food. I can be a sedentary. I don't have to make things, and that it's not like a healthier way of living.
No, that's a really good point. That's a good point because boy, I know people with Parkinson's and other neurological issues or other disease, not even neurological, just other health problems, who are doing better than people with no diagnosis of any health
Yeah.
problem, who just don't eat
Mhm.
well and don't exercise. So that's a good point. I'm glad you brought it up.
Yeah, and it is very interesting. And so it is hope for all Parkinson's disease persons and every diseases. If you the main focus on this is have a healthy lifestyle. I think it's one of the principal things about this. Yeah.
Can I ask you one question? We have a question from
Yeah.
Laura, actually,
Yeah.
about, so in relation to muscular contracture or stiffness for people with Parkinson's, what foods or
Okay.
supplements are recommended and which ones are, we went over that, some of that already, but which ones are contraindicated? Are there any that are contraindicated?
Well, contraindicated, no. There isn't anyone that is contraindicated. Well, such as junk food, but junk food, no, it won't help our muscle.
No,
But like
darn it.
one kind of vitamin or mineral that won't help our muscles, no. Everyone, it's indicated. I will talk about I think about muscular contracture. And
Okay,
this will I will talk about in mineral functions because there are two minerals that are essential to these kind of problems in muscular contraction.
great. Oh,
I
by the
will
way,
talk.
just so you know, in the interest of time, I'm not in a hurry, but I have 20 more minutes
Okay,
before
yeah,
I have to go. So I just want to make sure you know. Plus, I don't want to take too much of your time either, but
yeah,
I
no,
do
it's okay.
appreciate this so much.
Yeah, I will finish. There are a few slides. I
No
will
problem.
only emphasize some minerals and answer Laura almost question in these slides. Well, mineral, I already talked about vitamins. I will talk about minerals. And one of the principal minerals that will help us this disease, potassium and sodium, they're essential for brain neurons to transmit signals. They also help our neurons to transmit the signals produced by neurotransmitters. Uh, Only I want to emphasize here, if you have hypertension or pressure problems, blood pressure problems, you have to control the amount of sodium that you are taking. If you don't, because it is, well, also it is not recommended, like, okay, if they tell me that sodium will protect my neurons, I will eat sodium every single day. No, that is not the point. We only have to take it in amounts that we need our body to have.
Okay.
And also one of the principal things, well, is that it may help our brain maintenance. They help that the brain functions like it should function.
Okay.
Well, calcium, I think about calcium. This it's will phosphorus. I will emphasize here about that the one that are living with depression or any other mental health problem. For nutrients of phosphorus will helps regulate mental functions. So this will help your emotions to be more controlled. And it is also very important in all of our nervous system. It helps a lot of principal activities in this nervous system. One of the principles and the main focuses is that helps the neurons communicate better. And that is what phosphorus does in our brain.
Okay.
I will here, I wanted to be in this slide because this slide will answer a little bit of the question that made Laura almost. Magnesium has a very important role in our muscle mass and helps a lot to protect muscle contractions. And so there is, if you are regularity have these kind of problems, I will recommend you to have a more foods with magnesium.
Okay.
One of the principal foods that have magnesium is like nuts, like every kind of nuts have a lot of magnesium. And also it helps the transmission and neuromuscular coordination, that it is very important. It helps, and I wanted to talk about this because adequate concentration of magnesium in the brain alleviates the manifestations of Parkinson's disease. And this,
Okay.
I am not inventing this. This was on a research and an article that it has been published recently, that they found that magnesium helps a lot in every kind of manifestation of Parkinson's disease, especially in the muscular symptoms. So this is a very interesting mineral that we have to have in our daily diet.
Okay.
Yeah. Well,
You know, actually, I have been taking that recently as a supplement, and I'm pretty sure it's
yeah,
helping me.
yeah,
Like I can feel
yeah.
a difference.
Yeah, it does. It does feel. I only talk about supplements with magnesium. I will only recommend that talk to your doctor about this, because there is in the well, in the market they sell us a very huge amount of magnesium in a different ways. We have like oxidative magnesium, magnesium with phosphorus. So there is a lot of supplements. So I always recommend to first, like, well, Parkinson's disease, no, that ask to your doctors if you are safe to take magnesium, because sometimes it may intervene with medication. And if your doctor says, oh, it's okay, there is no intervention, then you can take it, or you can take it from diet.
Yeah. Okay.
That's a only thing that I have to say about magnesium.
Okay.
Iron is another essential mineral in the neurological function. It also helps synthesize neurotransmitters, participates in myelin synthesis. This chemical, or this is like a very, this myelin or mielina, like we said it in Spanish.
Yeah.
It's like a very, I forgot this word.
Is it
It's
like a protective layer around the
yeah,
nerves?
yeah,
Yeah. And
yeah.
I'm sorry,
Layer.
I'm interjecting, not to interrupt you, but I will for 1 second. I have a person who comes in here with a rare form of multiple sclerosis called primary
Yeah.
progressive multiple sclerosis. So right around
Yeah.
his C2, C3, the spinal cord myelin sheath is disintegrating. And so he has difficulty walking because the neurotransmitter, the message isn't getting properly to his legs.
Exactly.
So that myelin sheath is so important, because without it, you know, we can have some
Exactly.
serious problems.
And for example, yeah, and that was the word I was searching, like layer. This layer to our neurons. And iron and phosphorus, these two minerals are very important to that disease, that I will recommend to your patient. If he or she is seeing these lights, he needs to take phosphorus and iron, because these two minerals will help participate in the formation of myelin, and will help that this myelin will protect them. Now, for example, iron protects and synthesizes this myelin, so it is very important. So in patients with sclerosis, take a supplement with this.
Yeah. Okay.
Yeah, it's an interesting way.
Excellent.
Well, also, and I think it's last, yes, the zinc. It's another mineral that it is very important in neurons, because it modulates the plasticity of the neurons. A deficiency on this mineral is linked to neurological diseases and disorders. It is very linked. And also a deficiency in zinc damage our neurons. So that is why we have to take a diet rich in zinc. Yeah.
That's really interesting. So in little shameful self-promotion again. So in my second book, which I have my virtual background on, so the camera doesn't want to pick it up. Well, anyways, I wrote 2 books, and in the second one, in the English version, is the chapter on nutrition and Parkinson's, written by you, by my guest Cynthia Lopez. There it is. Cover art by Laura. But also we talk about, there it is.
There.
We talk about neuroplasticity a lot.
Yeah.
Because of retraining the brain to help us to move better and, remember better and sharpen your reaction time and cognitive skills is so important. So neuroplasticity can be helped by diet. And so you're talking about zinc. That's amazing.
Yeah.
If you want to, maybe we could, if anyone has questions, maybe we could have like, I have 10 minutes left. If anyone has
Yeah.
questions, ask away. And if you want to stop sharing your screen, you can. And if you
Yeah.
want to keep sharing, you can.
Yeah.
People on Facebook, if you have any questions, just write them in the comments. We do have one question here, which is there any new information on how to stop Parkinson's? I think it's more like that's a good question. I think it's more like how can we manage the disease and slow the progression at this point, whether it's nutrition, highly, highly, highly important, or exercise and training and keep them moving. Those are the ways of slowing. I don't know any way to stop it, unfortunately. I wish we could stop it.
Yeah.
Anyone in on Zoom, do you have questions? Just no questions on Zoom, no questions on Facebook right now. I do have a question though for you, so I'll ask the question. See, we went over everything. The only other question I have, and I sort of know the answer, but I want to hear your answer, because here's something that I see often. I see dehydration or lack of hydration. Now, the average age of the patients who I work with here in my clinic is, I calculated it out, it's 81 years old. If people are dehydrated and they're 30 years old, 40 years old, it's a whole lot different than an 80 or 90-year-old dehydrated, because a person who's dehydrated 90 years old or 80 or 70 something, the older we get, it seems like the worse it is, because it can almost seem, especially if they get a urinary tract infection because of dehydration and whatever else, and then they start to, it's almost like they lost their mind, and you'd think they have Alzheimer's or dementia, like all of a sudden one day they wake up and they've got it, but they don't. They're just dehydrated. What other things do you see, let's say, that are mal effects of dehydration? Because we know it's fairly common.
Yeah, and it is a very interesting question, because, and it is a very great point that we have to emphasize, because here in Mexico, it's the same case. There is a lot of dehydration, and people, they don't have the habit of taking water and of drinking water. Another principal consequences that they have is related also with the question of Laura almost about muscle stiffness. A dehydration, as a consequence, we'll have muscle cramps, we'll have greater muscle stiffness, and many of the patients are complaining of these symptoms. But if we see his or her habits, if there is these symptoms related to Parkinson or related to a lifestyle change, and it is because of dehydration, because we began to tell them, drink your water, you have to drink this kind, and all these muscle stiffness reduce a lot. And this is one of the principal things. Also, that it is very interesting that our brains to function, that is why you were telling me that these consequences you told me, our brains doesn't function as normal if it doesn't have water. He needs water to make all these kind of chemical processes and all these chemical reactions in brain. He needs water, and one of the principal things that happens is this: it affects the brain structure.
Oh, it does?
Yeah, it does.
I didn't know that. It makes sense though.
Yeah, it affects the brain structure.
Wow, I didn't know it affects the structure. Now see, this is very interesting, and I imagine the effect is probably not too good. I mean,
yeah, because it affects, affecting the structure of the brain will have a consequence, like the simple tasks that of cognitions that we make, we won't make it as it should, because our brain doesn't have the water that he or needs to these
wow.
things.
What about constipation?
Well, constipation is like
We know it's big
what?
anyways in
Yeah,
society and in
and
Parkinson's, but dehydration isn't going to help constipation at all.
exactly. And also, but dehydration also affects constipation because I always tell them, okay, you are eating your fiber, no, because you have this constipation and you are eating a lot of fiber, but water is the one that helps this fiber to like
Yeah,
push.
you got to move it out.
And exactly, and if you don't hydrate yourself, you won't have this thing that move out all your or your well, the things of constipation.
Interesting. It's, you know, to me, it's like so fascinating. And every time I talk with you, I learn a lot. And what's funny is I kind of know a lot of this already, but what it is I forget things. And there's so much to know and so much to learn, but also so much to
Yeah.
tie together. Like it occurred to me, believe I'm just gonna be honest with you. It occurred to me today, sitting here with you, that I know we need to have adequate strength to have adequate balance and movement. But if we don't have enough protein and nutrition, the right nutrients, we can't have enough muscle mass probably.
Right.
So this all ties in together. It
It's like a
doesn't
shame.
it doesn't
I
start only
Yeah,
with strength training. It starts with that, plus you have to feed those muscles you exercise to make them, help them develop more, right? Get stronger, grow bigger. I mean, it all ties in together, and I know this, but it just helps to talk with you a lot. It helps me a lot. Thank you
yeah.
very much.
No, thank you for inviting me. And what you were telling, it's correctly. And I always tell like it's like a chain. We have like this little chain, and if this chain it isn't linked correctly because we don't have the diet or we don't have the exercise or whatever else we need to take, it won't help our body to function as it should. And it is all related. It is all like hand to hand.
Fascinating.
Yeah.
Well, here's what I'd like to do. I'm going to stop the Facebook stream, but will you just stay with me for a minute, just for like
Yeah.
2 minutes? But first, I want to say thank you for those who are watching on Facebook. Thank you very, very much. And thank you for those who are watching on Zoom. Anita, Magdalena was here. A couple other people were here. Laura, thank you always for your support. You do so much to help both of us and so many other people. The work you do is incredible. And then more than anything, thank you, Cynthia, for being here and sharing your wisdom with us, because we need you. You know, the world needs to know what you have to tell us. So that's one of the reasons I'm here, is to capture it and share it. So
Thank
stay with
you.
me for a minute. I'm going to
Yeah.
discontinue the Facebook Live and stop live, and then I'll stop recording.